May is National Stroke Month. MageeNews.com is honored to have Miss Karen Wilkins with us today. She is from SafeHeart Health Screens. There we go. They always know I have a hard time getting it out. But anyway, she is going to be telling us a little bit about what's going to be available at the Magee General Hospital. And it's something I think all you listeners, readers will be anxious to know about. Karen, tell us a little bit about what we're going to be doing with the screens.
Sure. We are going to be, let me just double check that date, on May 22nd, Tuesday, May 22nd, SafeHeart Health Screens, which is based out of Hattiesburg, will be at Magee General Hospital offering 4 screens that test for risk of heart attack, stroke, abdominal aortic aneurysm, and peripheral artery disease, or PAD. We use portable ultrasound equipment, and the 4 screens take less than 10 minutes. There's no needles, there's no disrobing, it does not hurt.
Are you saying we do not have any needles in this? I understand.
No needles at all, no.
And they're taking off with the clothes?
No taking off.
Okay.
The only thing you have to take off is your shoes and socks.
Oh, okay.
For our PAD screen. But it's very high tech. You get a lot of really valuable information. The 4 screens that we do, we do a carotid artery ultrasound. We are taking ultrasound images, just like when you have an ultrasound done when you're pregnant. We're taking pictures of your carotid arteries on either side of your neck, looking for existing plaque buildup. And the machine's also measuring blood flow velocities. And our doctors look at that to determine, the degree of plaque buildup and whether additional follow-up testing needs to be done. And if you think about a tube, the narrower an opening, the faster the flow. So that's what we're looking at, is that there's elevated blood flow velocities. We do a second carotid screen called a CIMT, a carotid intimate media thickness screen. What that does, the same ultrasound probe, is measuring the thickness of the artery wall. And what that does is offer some really valuable information of early stages or preclinical signs of atherosclerosis. So if you have an abnormal CIMT, it doesn't carry with it the same level of urgency as an abnormal carotid, but really, really good information to have, to share with your doctor, and it's a good marker for increased risk for a future, cardiovascular event. So those are our 2 of the 4 screens. We do a 3rd ultrasound screen, an abdominal aortic aneurysm screen. We take a picture of your abdominal aorta in your stomach looking for enlargements or aneurysms. We do a PAD screen, peripheral artery disease screen. This one is looking for the plaque buildup that we were looking for in the carotids, but now we're looking for it down the legs. Okay, and that one we do what's called an ankle brachial index. It involves taking a blood pressure in the upper arm and in the ankle and using a little handheld Doppler ultrasound to do a calculation to determine if there's blood flow obstruction down the legs. So we do all 4 of those. They're usually $119 for all 4 screens, which even at that price is very affordable for the information that you get. But we're offering them at Magee General Hospital on May 22nd for $99 for all 4 screens. Our physicians in Hattiesburg interpret the data. Reports are mailed directly to the participants within 2 weeks of testing. If anyone has critical findings, which we have emergency protocols in place so that if somebody does have a critical finding, they're given pictures instantly, and they're given information to take with them immediately to the ER, to their doctor, to get immediate treatment. So short of being a critical, they would get their report within 2 weeks with the information they need to either go get follow-up care if the findings justified it or not. So
what if a person is on Medicaid? Is there any other ways besides cash?
There is a program that has been ongoing for the last couple of years now. It's called the SafeHeart Health Initiative. It was a legislatively funded program that was run through the Division of Medicaid, and it will expire at the end of June. Through that program, this does not involve Medicare, this is just Medicaid. Through that program, individuals with full Medicaid benefits coverage can have these screens done through Medicaid. In other words, Medicaid will pay for the screens to be done, and there will be no out-of-pocket cost to the individual, nor does it count towards their 12 annual physician visits that they're allotted through Medicaid. But if you're on the Magnolia CAN program, under the Mississippi CAN program, if you opted for either Magnolia or United as your Medicaid provider, then you would not be covered under this. It has to be just full Medicaid benefits and through Medicaid.
Well, you can't just show up for the thing. So what do people need to do if they want this?
I mean, we do have people every now and then show up, but honestly, it works so smoothly and so well. You're in and out of there very quickly if you call and schedule an appointment. So they can call our office in Hattiesburg. We have a toll-free number, which is 866-548-3006. We also have a website, which is the name of the company. It's SafeHeartHealthScreens.com, and you can sign up online. But you do need to schedule an appointment. If you do so, really the total turnaround time from the time you walk in the door, fill out the paperwork, which is very minimal, have the screen and walk out, it's probably, it's 20 minutes max. It's just 10 minutes to do the screening. So it's really
life-saving in 10 minutes.
Quick, it's easy, it's comfortable. We have these very comfortable massage tables. It's often hard to get people to get off the table when the screen's over. But particularly with respect to Medicaid, they have to call us beforehand and verify coverage because there are all different types of coverage, partial coverage, crossover claims coverage, all kind of things. So we can check that in 2 seconds with somebody on the phone. So whether you're Medicaid or not, or you're paying out of pocket the $99, just call us to schedule the appointment and we can take care of them.
MageeNews.com will have this information on the site. We'll have the phone numbers as well as the website address. And if you have any questions, you can contact, of course, me at Sue@MageeNews.com, and I'll pass it on to Karen or talk with them at the hospital. And this is a great thing that Magee General is doing for us, as well as SafeHeart coming and partnering with them. I hope you'll consider doing this. It could make the difference. It could be life-saving for you. Have a good day.